had my pre-op appointment with the physician's assistant who went over the surgery and how long it's going to be, the expected recovery time, my limitations for after surgery, which are going to be kind of challenging. Ordered my blood work I have to get done before surgery, and then ordered my pain medication that I'll be using afterwards. One thing that this process has helped me with is I'm not really good at being a patient. I am good at being the doctor. It's kind of weird for me to be on the opposite side of the table, so to speak, but it definitely reminds me, just like when I had my kids, it definitely reminds me of the level of fear or just hesitancy that people have when we're undergoing medical procedures, because truly, right, this is the first time I've met the physician assistant that's going to be assisting the surgeon. And it made me think like, wow, oftentimes I'm meeting people for the first time when we're doing something to them, or I could be meeting them for the first time on labor and delivery when they're having their babies. And this is always a humble reminder of what that feels like, of kind of having someone walk in your room and say, hey, I'm the person who's going to be taking care of you, and nice to meet you for the first time ever in life. Always a humbling experience when I'm sitting on this side of the table. One thing that I did, and I feel like I should highlight in this journey, is you really should, whenever you're having a medical procedure, surgery, baby, whatever it is, if you're starting on new medications or whatever, make sure that you ask all of the questions possible. Even ask your family what questions you should consider and write those down. I've talked to my family obviously about doing this beforehand, but there were questions that I'd written down that I hadn't actually thought of myself. I was very much like, what's the recovery like? What am I going to do for afterwards? When can I go back to work? But there were other things like, what are my restrictions for after, during the recovery? And one of the restrictions is I can't lift anything over 10 pounds. Okay. I have toddlers. I have babies that are like 25, 30 pounds. That's gonna be challenging, and my kids are very attached to me, so trying to figure out how I'm going to navigate that was just interesting. I didn't even think of that, oddly enough, beforehand. I was just thinking of, all right, the recovery is going to be this many weeks, and I can go back to work after this many weeks. So make sure you ask as many questions as you can. Ask your family for questions. In general, for this type of procedure, what the physician assistant educated me on was that generally the recovery time is about 4 weeks. That's 4 weeks of no lifting, no exercise other than like walking. And then what he described as having kind of T-Rex arms. So that's where the first couple of weeks I can only like do this essentially with my arms, nothing lifting, none of this, just kind of here. And then after the second 2 weeks, so 4 weeks out from surgery, I should be able to do kind of this motion and be able to start to resume my normal, full range of motion. So I won't be moving around a whole lot. I won't be doing a whole lot. I'm going to be trying to prevent my toddlers from wanting to be picked up. But generally, 4 weeks is the recovery time. Because I am a full-time OBGYN, and I do a lot of lifting and movement and a lot of different things when I operate and that kind of thing, I probably will need a little bit more time off before I'm able to fully return back to work, just because of all the different movements and all the different clinical responsibilities that I have. But we're going to see how the first 4 weeks go, and then figure out what I may need after that. I'm excited yet nervous. I guess less about the surgery itself and more about the recovery time and kind of what that is going to look like for me with who's young, or I think I'm young-ish, but with young kids, and how to navigate that. Now, I will say I have an incredible support system, so I have lots of family that are close by that not only are very involved with my kids, but that we're just a really close and tight-knit. So I actually will be staying with family for the first few weeks, and then depending on how I feel, how much range of motion I have, I will be going home with them, helping with my children and that kind of thing. So support and help at home for even if you don't have children, but even the basic things like cooking, cleaning, can be hard to do when your hands are like this or your arms are like this. So yeah, so I think that's all. So the next time you'll see me, I'll be heading in for surgery.